Conference. We welcome to the program now Dr. Randy Easterling, family care physician and addiction medicine specialist. And also, Dr. Easterling, I just got to share this. There was a time when you were, I believe, president of the Mississippi Medical Association.
Yes.
And I'm not sure if you remember, sir, but you and I participated on a panel discussion.
In Oxford.
Yeah. And I think that was 2009.
2009. You got a great memory.
And that was just before we were talking about health care reform as sort of proposed by the Obama administration. That was absolutely transformational legislation, finally passed, as you recall, in March of 2010.
Mm-hmm.
You and I were part of a panel moderated by Andy Taggart. We were just talking about what is all this going to mean. And what I remember more than anything, before we get into the meat of our discussion, is a lot of people just said this thing's not going to pass, and if it is, the Supreme Court is going to strike it down. And I remember so vividly saying it's going to pass, and it's going to be permanent, it's going to be here forever.
Yeah.
And that's what we got.
Well, John McCain, I think, gave that to us.
He did.
When he went thumbs down.
When he went the thumbs down, we had an opportunity at least to scale it back. It wasn't full repeal, as a lot of people think, but the proposal at that point, when McCain was in the Senate, was to kind of scale it down somewhat. But he said no, and that ended that. All right, so at the End It for Good conference, of course, you being an addiction medicine specialist, that's what this conference is all about. I know you were just making remarks here to the attendees. What was the message there?
Well, what we talked about mostly is opioid use disorder, which is a pandemic in and of itself. In 2021, we lost 100,000 Americans from accidental drug overdose. 75,000 of those were from opioids. And of those from opioids, 75% of those were fentanyl.
Wow.
2022, we lost 110,000. So we went up 10,000. And 75% of that was opioids, which comes to about 82,000, and 75% of that was from fentanyl. We lose about 225 Americans a day from opioid use disorder, or people that overdose from opioids, not necessarily opioid use disorder. And one of the messages I try to get across, especially to the younger people, younger than you and I, is that if you're on a college campus, if you're hanging around with your friends, if you take a pill that didn't come from a pharmacy, you have to understand, did not come from a pharmacy, it has fentanyl in it. End of discussion.
Really?
Any pill you can buy out here that didn't come from a pharmacy has fentanyl. Now, the only question is how much does it have? Fortunately, most of it doesn't have enough to kill you, but unfortunately, we see a lot of people, especially younger people, that are dying from fentanyl overdose, and they don't have substance use disorder. They got it because they thought it was Adderall. To study. And it may be Adderall, but it's got fentanyl in it.
Well, even though it's a small amount, not enough to kill you, as you say, is it enough to addict you to the fentanyl itself, which ultimately you continue to ingest could kill you?
Sure. Of course, a lot of times they don't know. Well, most times they don't know there's fentanyl in it. So if they survive, they just thought they took Adderall and got sick.
Gotcha.
But it's certainly highly addictive. It's a very fast-acting opioid that, of course, has deadly effects.
And so is the problem, Dr. Easterling, is it more pronounced in Mississippi than the nation at large, or are we about kind of in line with that? Where do we stand?
Well, when we had the prescription problem with opioids a decade ago, we were writing more hydrocodone than any other drug, including antihypertensive medication, diabetic medication, cholesterol medication. In Mississippi, we were writing the hydrocodone was the number one. I think we've kind of gotten our arms around that, but now we've got the fentanyl flowing in from Mexico, coming from China, and so it's so cheap and it's so available. If you want that high, it's just there.
Yeah. Well, has the healthcare industry changed and sort of learned from the overprescription of hydrocodone, for example? I know pharmaceutical companies have been sued over this and lost those lawsuits. So where do we stand on that?
Yeah, I think so. And let me make something perfectly clear. The large majority of physicians, 99% of physicians that wrote opioids on a regular basis did so thinking it was helping the patients.
Okay.
If I used to run an emergency room, if you came into my ER 25 years ago with a sprained ankle, you got 10 or 15 narco.
Okay.
And so I educated myself, and we through numerous venues, have educated healthcare providers that, number one, Tylenol and Motrin works just as well, if not better, for most pain than does opioids.
Okay.
Number two is you don't need to give as many. We used to give 30. 30 was just kind of a routine thing. Now you really don't need to give over 10 at the most.
Okay.
So it's an education process.
Yeah.
And I think sometimes the public was left with the impression that doctors and nurse practitioners and dentists and all that and pharmacists were just out there giving this stuff away so they could make money. And that's not the way it was at all.
Yeah. Well, I mean, the last thing you want as a physician, I'm sure, is somebody calls you, man, I'm in pain. And then you feel like, well, maybe we didn't prescribe properly or sufficiently or something like that. I mean, I'm a person who's had surgery, one-day surgery in the hospital, and you may have pain after that. You get a prescription for that. Mm-hmm. I never took any because I never had any pain, and I was always afraid that I don't have any pain, I don't need to be taking this drug. Mm-hmm. That's fairly common, though.
Yeah. If you've got 100 people in the room and I give every one of them a prescription for hydrocodone, a 30-day prescription, and they take at least one pill a day for 30 days, about 60% of them are going to end up taking it 5 years later.
Wow. Okay. Well, that's interesting. All right. So the End It for Good, Christina Dent, of course, who runs this, and Brett Montague, and founded this organization. What do you think about their ideas and their approaches to addressing drug addiction?
Well, one thing, and I'm not that familiar with End It for Good. I try to accommodate and try to speak when I can to anybody that's legitimate, and they certainly are. I think what they're doing today is interesting, and I think it's beneficial because they're getting different perspectives on how to treat substance use disorder. My talk was on basically using buprenorphine or Suboxone to treat opioid use disorder, and that's very common now. I'm on a SOARS 3 grant from SAMHSA, and that's pretty much all I do. And so I think it's very beneficial. But there are other avenues, too. It's not one pill. Not one thing is going to take care of.
Metaphorically.
Not going to take care of the problem altogether.
Well, I think one of the concerns is that our laws are such that just sometimes simple possession of illegal drugs, that lands you in jail, could be for a long time. You're really not curing the problem. You're still addicted. You come out, you're still addicted.
Well, if you believe what we believe and what has been shown scientifically, that substance use disorder is an illness, why would you like someone up for being ill? Now, there are exceptions that obviously if you're selling the drugs, but
committing crime.
We need to have more treatment-oriented opportunities instead of prison opportunities. We got way too many people in jail as it is. We can't pay for it, but divert some of that money into treatment. And unfortunately, because of various and sundry things, instead of going up on treatment in Mississippi, we've actually come down on the number of beds we have available for people that have substance use disorder, and that's very, very unfortunate.
Is it, where do you stand on this? I've heard physicians talk about just some of us are born with this inclination just to be addicted, have this kind of tendency, whether it's drugs or gambling or something else. Do you think there's truth in that? Is that just something that's kind of embedded in you?
Yeah, I think there's some truth to it, but I see it as a combination.
Okay.
Why do young men tend to abuse their spouse, their wife, more if their father abused their mother? Because they saw that that's the way the man in my life dealt with frustration and anger. And I think when you grow up in a family where someone abuses substances, be it alcohol or other drugs, you say, well, that's the way, and it's a subtle thing. That's the way you deal with anger. That's the way you deal with depression. That's the way. And so I think it's a genetic component, certainly, and it's a psychosocial and environmental component. I kind of go the middle of the road on it.
Okay. So it's sort of back to this situation where a functional, stable home means a lot to producing productive, stable adults. If they experience that as a child, the deck's stacked against them big time.
And that's certainly one of the huge problems we have in this country, and I guess worldwide, but probably more so in the United States. There's just too many kids out there that don't have fathers.
Yeah.
They have mamas, and the mamas, in most part, do the best they can. But I'm a real believer. I grew up in a two-parent home, and I think that that was invaluable.
Yeah, there's no doubt, and as you well know, it's a big problem here in the state of Mississippi as well.
Yeah.
Good to see you again, Dr. Easterling. Appreciate you coming on. Thanks for all your wisdom, sir. Appreciate it.
Thank you.
Yep. Folks, we're stepping aside for a break. The Element Well Studio down at the Jackson Convention Center for the End It for Good conference. We've got Representative Lee Yancey at 11:50.